Hi, my name is Angela, and today I'm going to be doing a physical assessment of your thorax and your lungs. I'm going to start by cleaning my hands with some hand sanitizer. And we already went over the health history questions prior to starting. So first, I'm going to ask you, can you please tell me your first and last name?
Sure, John.
And can you please tell me where you are right now?
My room.
Please tell me why you're here.
For the checkup.
And can you please tell me the day of the week?
Tuesday.
Good. So he is ANO times 4. His facial expressions are calm and relaxed. And now I'm going to inspect the chest. So the slope of the ribs is 90 degrees, which is a normal finding. The scapula is symmetrical bilaterally. The skin color is even and it is normal for his ethnicity. And the skin is also smooth and there is no moisture that I can see. There is no lesions or discoloration. And the trachea is midline. The lips are pink. Can I please see your hands? The nail beds are also pink. And now I'm going to check for capillary refill. Good. Other hand, please. Good. So capillary refill is less than 2 seconds on all 10 fingers. And his the shape of his chest is elliptical. He is sitting erect and he is able to support himself. Now I'm going to move on to listening to or counting his respirations. So I'm just gonna observe for 1 minute. Okay, so his respirations are 20 breaths per minute, which is a normal finding. And his breathing is effortless. There's no use of accessory muscles. He has regular rhythm and there is moderate depth. So inspection of his chest, there is no retraction or bulging. Also, his trachea is midline. And next, I'm gonna just observe the chest expansion while breathing is symmetrical on both sides. So now I'm going to perform tactile fremitus, in the second intercostal space to protect his privacy. So I'm just gonna put my hands in the second intercostal space. Should be right here. Can you say 99 for me?
99.
One more time.
99.
Okay. So the vibrations I could feel equal bilaterally. And next I'm going to palpate, but just high up. So I'm gonna palpate up here. Have you noticed any lumps or masses in your chest? Okay. So there's no lumps, no masses, no tenderness, also no lesions. The skin is warm and dry. And next, I'm going to percuss. So I'm only going to percuss in the second intercostal space, but if we were doing this on a real patient, we would go down to maybe like the 9th or 10th. So okay, so I hear resonance throughout. And next I'm going to auscultate. So I'm also going to keep it high up. Go ahead and breathe. Take a deep breath for me. Okay. I think I messed that up just because I wasn't moving the stethoscope correctly. So I'm supposed to move it kind of like in a ladder, comparing left and right. So right now I'm listening to the second intercostal space. Take a deep breath for me. Now I'm going to listen to the left second intercostal space. And now the left third intercostal space. And the right third intercostal space. Okay, so in the second and third intercostal spaces, I heard clear breath sounds and I heard bronchovesicular sounds. I didn't hear any adventitious sounds. Next, I will be doing, I'll do that on the back side. Okay, so can we turn you around to the back? Yes. Okay. So upon inspecting the posterior chest, I see that the spinous process is straight. Also, now I'm going to inspect the skin. So the skin color is even and it is normal for his ethnicity. I don't see any masses or lesions. Next, I am going to observe for symmetrical chest expansion. So I'm going to put my hands at about the 9th intercostal space, or no, T9. So I'm going to put my hand at T9. I'm going to pinch a little bit of skin to watch for it to rise and fall. So can you take a deep breath for me? One more. Good. So I observed symmetrical chest expansion, and now I'm going to feel for, I'm going to do tactile fremitus to feel for equal vibrations throughout. So I'm going to start at the second intercostal space. Can you say 99 for me?
99.
99?
99.
99?
99.
99?
99.
Good. So I felt equal vibrations bilaterally throughout. And next I'm going to palpate. Have you noticed any lumps or masses on your back recently? Okay. So the posterior chest does not have any lumps, masses, tenderness. It is dry, it is intact, and the temperature is warm. The temperature was also warm on the anterior chest. So now I am going to percuss. I'm going to percuss in the intercostal spaces. I'm going to start with T2. Or actually, that was over the scapula, so I wasn't able to hear anything. I'm gonna go closer to the spinous process, not over the scapula. Okay, so I hear resonance throughout, which is a normal finding. And now I'm going to oscillate the breath sounds. So when I put my stethoscope on your back, can you just take a deep breath for me each time? So I'm gonna start. Go ahead. Good. So breath sounds are clear, and I was able to hear vesicular breath sounds throughout, and there was no adventitious breath sounds. Also, I don't know if I mentioned, but on the front I heard broncho-vesicular breath sounds. And now I'm gonna perform bronchophony. So I'm gonna listen, and when I put my stethoscope on your back, can you just say 99 for me? Okay. I'm gonna listen right here.
99. 99. 99. 99.
Okay. So when he says 99, it sounds soft and muffled, which is a normal finding. And now I'm going to perform egophony, which when I put my stethoscope on your back, can you just say E for me?
E. 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 E.
Okay. So when I do that, I do hear the letter E, which is a normal finding. And now I'm going to do whispered pectoriloquy. So when I put my stethoscope on your back, can you just whisper quietly 1, 2, 3?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. So I was not able to hear the whispering in the stethoscope. And I think that is the end of our physical examination. Thank you.